Of all the things that I have to give the critics of America, the one thing that frustrates me the most that I have to hand over to them is America's treatment of our children. We have habitually fallen short on protecting our children since the establishment of this country, and we still do it to this day. Enter Scott Atlas. Dr. Scott Atlas has risen from the ashes of the smoldering garbage heap that is academia and the science community to bring the truth, the good news about children and the bug to the world. And he's doing it with the shadow of a cross across his face. I don't know, there's a window, but it seems pretty significant to me.
The latest political divide appears to be over going back to school, with Democrats mostly urging caution and Republicans mostly, starting with the president, saying that kids need to get back into the classroom or risk a learning loss that may be irreparable.
Going back to school presents the biggest risk for the spread of the coronavirus. They ignore science and they ignore governance in order to make this happen. If there are CDC guidelines, they should be requirements.
If there's CDC guidelines, they should be requirements. God, how can people still listen to this woman? Listen to what she just said. If there are CDC guidelines which have been habitually incorrect at every step of this entire thing, we should make those guidelines that have been wrong requirements. And then the all-holy invocation of science. You don't follow the science. Well, Dr. Scott Atlas is here to tell the good people about the science.
Dr. Scott Atlas, Senior Fellow at Stanford University's Hoover Institution and former Chief of Neuroradiology at Stanford University Medical Center. Doctor, welcome back to the program. Good to have you. She says,
Thanks,
Nancy Pelosi says that this is the biggest risk to the spread of the virus if the kids go back in September.
I think we have a different scale because that's just completely wrong and contrary to all the science. And when I say all the science, I'm talking about science from all over the world, not just in the United States, but Switzerland, Sweden, Canada, France, the Netherlands, Australia, Asia. It's really totally contrary to the science. And here's the science. I'm not sure how many times it has to be said, but the risk to children from this disease for fatality is nearly zero. The risk to children for a significant illness is, quote, far less than from seasonal flu, according to JAMA Pediatrics. This is totally antithetical to the data.
According to JAMA Pediatrics, the flu bears a significant more danger to adolescents.
And the other thing that we have to, obviously, we know this by now, it's been confirmed all over the world. Children rarely transmit the disease to adults.
Well, that's the biggest concern. Pardon me for hopping in, but that's the quickest rebuttal to that. That, yes, but these kids aren't going to realize they're carriers and they're going to go home and infect their parents or their grandparents.
Well, but those are people that obviously either don't know the data or are refractory to learning themselves because
refractory to learning themselves. It's a hilarious way of putting that they're idiots.
Facts say otherwise. And this has been proven by contact tracing all over the world by studies on these kids. This is really ludicrous, but I think the most important thing of all, there's 2 points I want to make. One is that teaching is a young profession. In the United States, half the teachers are 40 or less, and a quarter of them are under 30. 90% are under 60 in public schools.
That actually kind of scares me when I think about my generation and what we learned in school, and now that generation is teaching at such a high rate.
Have almost zero risk from this. And for those high-risk teachers, which there are some, if they believe in masks and social distancing, don't they know how to do that by now? And if they're still afraid to do their job, why can't they teach from a distance? If they think social distancing works, teach in the class. If they think distance learning works, teach from home. But the problem here, and this is the biggest point of all, I never hear anyone talk about the harms of closing schools. The harms are against the children. Anyone who prioritizes children would open the schools. That's just counter.
Okay, anybody who would prioritize children's health in our country would say open the schools. Thank you, Dr. Scott Atlas. You know what? This is what a scientist looks like when he feels comfortable that he can fall back on data to represent his opinion.
To say that, the children are not the risk, or, we're at risk here. When we see the harms to children, most children learn most of what's in school from social engagement, from learning how to resolve conflicts, from dealing with others. This is obvious. When children learn that they need a hearing aid or glasses, that's done in school. There are almost 250,000 apparently reported child abuse cases missed because children's child abuse is most noticed in the schools. And so, I'm not sure. We are the only country in the world. This is a level of hysteria. Like, this is something, I feel like I'm living in a Kafka novel here. I get thousands of emails a week from all over the world, from professors, teachers, mothers in the United States and elsewhere. They are stunned that we are willing to just simply destroy our children out of some bizarre notion that is completely contrary to the science.
Yeah, we watched, some countries in Scandinavia that went right back. The kids all went right back, and they did very well. This is really important. The kids, the learning deficit is so dramatic, and we're going to talk to Betsy DeVos about this later in the week. But Dr. Atlas, I got to go, but thank you so much. Always good to have you with us.
Dr. Scott Atlas, data-backed, on television, calling out the vile people who are trying to prevent our children from going back to school for, at best, reasons that are not based on anything but their own personal fear, and at worst, are to actually hurt the children of the United States. Let's go.
President Trump talking about his push to reopen classrooms in the fall and also threatening to withhold federal funding from those schools that don't open their doors. My next guest says the debate over school safety is stirring up too much hysteria. Dr. Scott Atlas. He's from Stanford University's Hoover Institution and is the former neurology chief at Stanford Medical Center. Thank you for being here, because we're trying to have a real conversation about how we get this done. It's in the best interest of everyone to have our kids get back into the classroom safely. So the first question is, can we do it?
Good morning, Sandra. Well, thanks for having me. Yes, of course we can do it. Everyone else in the world, in the Western world, our peer nations are doing it. We are the outlier here. And why are they doing it? Because the same reasons we should. Number one, we know at this point, if you believe in the science says that the 99.97% of deaths in the U.S. are in people over 15. 99.9% are in people over 24. The hospitalization rate for influenza, according to the CDC, is much greater, quote unquote, than from COVID-19 for children. The JAMA pediatric study, 46 hospitals in North America, pediatric hospitals, quote, the risk of a critical illness from COVID-19 is far less than from seasonal influenza, unquote. There is virtually zero risk to children for getting something serious or dying from this disease. Anyone who thinks schools should be closed is not talking about the risk to children. That's factually true, and they should say that. It has nothing to do with the children's risk. Now let's talk about the risk to teachers. Mm-hmm. The teachers are, because this is probably the big fear here, obviously.
So what he's saying there is that the people who are saying that children should not go back to school, it's out of their own fear, their own, a lot of times, misguided, irrational fear, but sometimes it's their own actual fear. Because if you have 2 or 3 comorbidities and you're over 65 years old, you have an actual fear of this, as you should. But you're not supposed to put that on our children.
The teachers, first of all, are a young population in the United States. K through 12 teachers, half of them are under 41, 82% are under 55. These are not high-risk age groups. We know this by now. And it's true that there are high-risk teachers, and those teachers should be able to believe in their social distancing and masks like they do for every other essential business. When they go to the grocery store, for instance, they can teach using social distancing. And if they're still afraid, they can stay at home. There's no reason to lock up the children. I'd like to talk about the harms to the children.
There is no reason to lock up the children.
The children are never in the discussion for some bizarre reason.
You mean the harms if we don't send them back to school?
The harms to the children for closing schools. Excuse me. Thanks for correcting me. Yes, I mean, this is the biggest problem of all. Yet again, we're going to commit some severe public policy without regard for the harms of the policy. Children are not just learning from, first of all, long-distance learning is a failure. 50% drop in math ability, 30% drop in reading ability. Half the kids, or 20 to 50% of kids, don't even log on. This distance learning is not going to work. But besides that, the most important thing...
And that was a savage dress down of the idea of distance learning employed on a large scale.
The kids learn are other things like social interactions, like maturation, like learning to deal with groups, group conflict. You can't learn that on a computer. Moreover, the schools are where we learn that kids need a hearing aid.
But Dr. Atlas, to be clear, while you are saying how important it is to get kids back into school and do so safely, you are encouraging that CDC guidance be followed, that there's mask wearing, social distancing, and all of the precautions that they're recommending?
Not for children. That would be irrational.
Not for children. That would be irrational.
It doesn't matter if children get the disease. They don't get sick from this. And the data shows that they do not significantly transmit to adults. And this is data.
But
this is not a
isn't the point to stop the spread? And I'm sorry, I don't mean to cut you off, but I mean, the science shows that mask wearing stops the spread of the disease. And don't we have a collective duty in this country to stop the spread?
There's no rational reason or science to say that children transmit the disease significantly. In fact, there's data to the contrary. You either believe in the science or you say you believe in the science and act contrary to science. The science says, and this is data from Iceland, Sweden, Switzerland, the Netherlands, France, the UK, Australia, Canada, Ireland, everywhere in Germany, everywhere in the Western world has shown that children do not transmit significantly to adults, even their own parents, and that teachers are not at higher risk of getting a disease like this disease from children. You either believe the science or not. You can't insist you believe in the science and then act contrary to science. And by the way, like I said, we are the only country not opening schools. This is absurd. I get thousands of emails.
So what are you suggesting then? I mean, the president says that politics are at play.
And he's delivering this message, and now this cross is migrated over on top of his face, which I find truly bizarre. Intentionally symbolic, I don't know, but
for keeping kids home and other harsh restrictions that we're seeing across the country. Do you believe that?
I believe that there is zero reason, in fact, zero excuse to not have the schools open in person. The Hospital for Sick Kids in Toronto, one of the world's best hospitals, just delineated this. Schools must be in person, no masks, no spacing. Because children are not at risk. If you believe that there should be some kind of restriction on schools, you're not talking about children.
But Doctor, it's a fascinating conversation. I don't mean to cut you off, but there's so many things to talk about there, because there are kids who fall into the high-risk category. There are kids with asthma. How do you protect them?
Well, of course, Okay, there is a small minority of children that are at high risk, and those kids need to be protected. That's always true. Let me put it this way. Seasonal influenza is more risky for children, more than COVID-19. Seasonal influenza is transmitted from children to the high-risk adults who are teachers every year. Seasonal influenza in California, the percent of deaths in children was 5.4%. 0 kids have died from COVID-19. If teachers think that they can't work during this, then they absolutely must say that we have to close schools from November through April.
All right, but what we don't know is how this is going to interact with the flu season, and that's what Dr. Redfield is warning. Listen to him, and I'll get your thoughts on the...
And this is hilarious to me, because I don't know if this lady's playing devil's advocate or if she really is just, she does believe these things. But he makes point after point after point that he just doesn't understand why with this situation things are gone so irrational. But anyways, let's listen to her again. She's trying to play the devil's advocate, I hope, or maybe she really loves CDC's Dr. Redfield.
Listen.
I do think the fall and the winter of 2020 and 2021 are going to be probably one of the most difficult times that we've experienced in American public health because of what you said, the co-occurrence of COVID and influenza.
So, Dr. Atlas, how do you respond to that? We don't know what an entire flu season looks like combined with COVID-19. And as Dr. Fauci continually warns, there's so much that we still don't know about this disease and the spread of the disease. Doesn't that concern you, putting all these kids back into the classroom together?
I find it bizarre that people focus on some kind of statement, we don't know everything. We don't know everything about any single disease. We know a massive amount. It is proven that children have no significant risk. It is proven that influenza is worse than this for children. It is proven that children don't transmit significantly to adults. That's proven. Why do we keep saying, but we don't know X? People insist it's all about the science, and then we go and irrationally endanger, destroy our children because it's not about the science.
We're at the mercy of the medical experts that are obviously advising the president, advising the top levels of our government on all of this, Dr. Atlas. Dr. Anthony Fauci is being taken on by the president's own economic advisor in this new piece published in USA Today. He's basically saying Fauci's been wrong about everything that he's interacted with him on.
Yep, he has.
When you ask me whether I listen to Dr. Fauci's advice, my answer is only with skepticism and caution. So are you saying that Dr. Fauci's advice, are you disregarding what we're hearing from those top medical experts advising the president?
I'm saying look at the science. I'm saying use critical thinking and logic.
Look at the science. Use critical thinking and logic. That's what Dr. Atlas is calling out to the American people to do. And he's doing this for the sake of the children. And I hear a lot of people virtue signal about the children, but I don't see a lot of action done.
Things are known. If you don't believe that in the science, then stop saying you believe in the science. The science says open the schools. The science says there's no risk to children. The science says teachers are not at risk if they go to school. Listen, either schools are an essential business in this country or they're not. I don't understand why people don't take into account the severe harms of not having schools. Yeah. Isn't that what public policy is all about? To weigh what you're doing, not just stopping COVID-19 at all costs.
But they put us into a full lockdown without accounting for the effects that was going to have, the counter effects. And now they're also not reporting on the drug overdoses, the suicides, the instances of abuse, because they are doing exactly what he's saying they're doing. They're establishing public policy, and it's not based on the science. It's actually based on their own irrational fear of this.
We start acting out of fear and are an outlier in this country's finished.
Well, Dr. Fauci, to be clear, is saying we should try as a default to get the kids to stay in school. However, that's going to vary according to where you are in the country and the dynamics of any outbreaks as they happen. It's a fascinating conversation. We want our kids to get back in school. We need them to be educated and socialized. Dr. Atlas, we appreciate your thoughts this morning.
Dr. Atlas speaking out for the children like this reminds me of Vigano's letter to Trump. Not to mention the fact that it said right in the first two sentences it was biblical. I haven't heard that anywhere. But he also spoke of the children of light and the children of darkness, and how the children of light need to stand up and speak out. And then Flynn wrote a letter, and it was very similar to the same things that Vigano was saying. And, of course, immediately he was attacked in the corporate mainstream legacy media. Michael Flynn writes column confirming he's definitely insane. But he's not. We know he's not. And he says our future, the future of our children and grandchildren, and the future of our country are at stake. If we're not going to stand up and speak for the children, then who will we speak for? Anyways, guys, like, share, sub. I'll talk to you later.